Welcome to On-Demand Learning with Michigan State University College of Nursing. This session is part of the Help Pain series. This is part 4. This session is 0.5 contact hours of nursing continuing education credit. Michigan State University College of Nursing is accredited with distinction as a provider of nursing continuing professional development by ANCC. The learning outcome is that upon completion of this learning activity, participants will state increased knowledge of providing appropriate school accommodations for students experiencing pediatric pain and how to utilize help pain training in professional development days by achieving 80% or greater on the post-session evaluation. Criteria to receive contact hours for this activity are to view the learning activity in its entirety, complete the post-session evaluation with a score of 80% or greater, and complete the survey following the post-session evaluation. At the end of the learning activity, scan the on-screen QR code with the phone camera to complete the post-session evaluation, survey, and payment if necessary. Following completion of the evaluation and payment if necessary, an electronic contact hour certificate will be delivered to your email address that you provide.
Welcome to part 4 of a 4-part series on Help Pain, which is cognitive and behavioral strategies for managing pediatric pain. The objectives are to understand how to provide appropriate school accommodations for a child experiencing pain symptoms, applying cognitive strategies to address pain in pediatric samples, and to learn how to lead a professional development day in a school setting that discusses the lessons taught throughout the Help Pain training program. First, we'll talk about how to implement the Help Pain skills. There's some flexibility with regards to how the Help Pain program can look in practice, given a particular school or setting or child, but here are some examples of how this program can look when working with a student, particularly one in a school setting. We really encourage people to move from unscheduled crisis visits for pain management to scheduled visits, potentially 1 day per week where the child has scheduled a time to come in and work on a help pain strategy. At the outset of that session, the provider may screen for functional disability or average pain ratings on a 0 to 10 scale, and then they may elect to practice 1 to 2 strategies each week. They should try to get these strategies well practiced before introducing a new strategy. To support school providers and other care professionals, we have guided practice videos available on our YouTube channel. We recommend a provider go through these strategies with a child during a live practice session before assigning a child to work on these skills independently using the videos as a guide. We recommend that a successful Help Pain program also involves communication between the provider and the child and the student's teacher. It may also involve communication with parents. Although we really like to move towards scheduled visits, we still think it's important to allow for the occasional unscheduled visits when a child is in a pain crisis. This may involve a certain number of fast passes where a child can practice CBT strategies when experiencing an active pain flare. The goal of strategies such as this is to avoid an absence in school. We also recommend communication with other team members as appropriate to support a team-based approach to care. In another series of this program, we talk about running a coping skills program. So that is one way multiple providers can collaborate to optimize student care. This is a sample plan that shows a 6-week period of time that a child would regularly meet with a school provider to work on different aspects of the Help Pain program. And again, this is not a hard and fast program, but a suggested approach to implementing some of these strategies so that the children are exposed to all of the various techniques that are part of this program. We recognize individual kids may need more time practicing certain strategies, or it may not always be feasible to implement these strategies on a weekly basis with a child. And we also acknowledge other kids may need additional support after a 6-week period, for example, to review and practice or to manage a new situation or pain flare that occurs. Now let's talk a little bit about what school accommodations might look like for a child experiencing a chronic painful condition. Our expectation is whenever possible, a child should attend school even when they're experiencing pain symptoms. So for example, if a child reports a headache or a stomach pain, we really encourage school providers, front office staff, to really encourage the child to stay in school. In order to do this successfully, we need to increase the child's comfort in the school setting and reduce their stress levels. Here are some examples of how that can be feasibly achieved. One can be through a formal healthcare plan or IEP, 504 plan. This may include accommodations such as flexible homework scheduling, so that a child's not doing a lot of busy work, but only completing the critically required material to ensure that they've adequately learned different concepts. We recommend that if a child is using school books, they are afforded 2 sets of books when possible, so they have 1 pair of books at school and 1 at home, and they don't have to carry heavy books back and forth in their backpacks. We recommend a child with chronic pain has regular access to both snacks and hydration. In some instances, such as if a child has debilitating back pain or musculoskeletal pain, they may benefit from use of an elevator if in a multi-floored school. We also recommend a child has access to both scheduled and unscheduled opportunities to practice their skills with a school provider as part of this program. A plan should be shared with parents and all school providers who are part of the child's care. And we offer sample accommodations and additional guidelines in our Help Pain Toolkit. If a child has been absent for a period of time as a result of their pain symptoms and is planning on returning to class, we offer several recommendations to help optimize the student's success. One is to take a gradual approach. We recommend a child start small. Maybe they just drive by initially or just attend a small part of one day and then build up from there. We also recommend the child starts positively. Ideally, if it can be arranged that a friend or a trusted adult can be present to greet the child, that can really help a child feel welcomed and secure. Another suggestion is to have rewards available to the child, such as free time or some other sort of school appropriate reward, to really encourage and reinforce their attendance. We also recommend that everybody prepare for setbacks and realize that this can be a part of the process. Success is not always linear, and sometimes kids need to take some additional steps before proceeding to a next step. And that's okay and should be supported and acknowledged as a common part of the process. Here's an example that may be helpful when thinking about how to engage families with regards to improving school attendance related to pain management. Mike is a 10-year-old boy who's active in soccer and has had an injury which resolved, but he continues to have pain. As a result, he's missed a lot of school, and even when he gets to school, he asks to go home early. So the question is, using these strategies and approaches, how would we consider keeping Mike in school? As you reflect on this, some considerations may be using a team-based approach to really encourage Mike to stay in school, affording Mike opportunities to practice his relaxation strategies and to give him access to additional accommodations that may help optimize his success in school. Perhaps a small reward for any successes would also help encourage his progress in this area. A common question we get is, what about homeschool? Is this an appropriate way to support a child with chronic pain? Indeed, there are more options than ever, so this is a question parents often ask us. While there are many reasons parents may choose homeschool as an educational approach to support their child's needs, as far as pain management goes, we generally recommend a child physically attend school in person. It is usually not helpful to homeschool a child exclusively because a child is dealing with chronic pain. Rather, we recommend going physically to school and having appropriate accommodations in place to support and optimize a child's success. Being able to engage in school will hopefully promote success in future activities that will require in-person attendance and engagement. Another strategy that's helpful for children with chronic pain, and really all children and adults in general, is how to be assertive. Social behavior falls on a continuum, and the assertiveness scale is one example of this. On one end of the continuum is passive behavior. This is a child who behaves kind of quietly like a mouse. On the other end is more aggressive behavior. This can be more hostile, physically aggressive, and also verbally aggressive. In the middle is assertive behavior. That's where a child can stick up for themselves both calmly and confidently to assert themselves and request what they need. An assertive child uses eye contact, a confident posture, and a clear voice. They state clearly what they want and need in a manner that is polite and calm. In general, they remain calm and confident. Even if they don't feel that way inside, they express it with their external behavior. To do so, they incorporate other skills they've learned to relax their bodies and calm their minds. And they consider both short and long-term consequences of their behavior when engaging in difficult conversations. This is an example of how to use assertiveness. Emily's a middle schooler who comes to see you and reports her math teacher has not been accommodating to her when she's experiencing pain. Emily feels this teacher believes she's faking her pain symptoms, which has been causing her stress, and now she's dealing with increased pain and does not want to go to this class. How can you help prepare Emily to be assertive and talk with her teacher? What strategies would you recommend to help support her in doing that? So as you reflect on this, some things you may want to do is actually practice having this discussion where you role play with Emily so that she can work on advocating herself, and you can give her feedback on her posture, her voice, the language she uses. This can be really informative and helpful for a child. You can also reflect on how one can sound calm even if internally they feel nervous or scared when having a difficult conversation. Perhaps you have a relationship with this teacher and you can also communicate with this teacher in advance if you think it would be helpful. If you anticipate it might be problematic, you can also consider physically being present during these discussions or engaging parents to be present as well. To help support a child to successfully utilize assertiveness, you may recommend a child use some other calming strategies learned in other parts of this series, including deep breathing, relaxing images, or other approaches to calm the body and the mind. Upon completion of this 4-part series, some providers may elect to use this training to implement a professional development day in their schools so that other school providers can be exposed to some of these strategies and this approach for caring for kids with chronic pain. One such trainee who completed this training implemented a professional development session within a PD day at her school. She served as a district nurse, and together we collaboratively created a 30-minute overview of a few select strategies. We selected pain assessment, the gate control theory of pain, relaxation strategies, and mindful eating. These are included in earlier parts of this series. We had 37 participants from the school district engage in our PD content area, which included teachers, athletic personnel, cafeteria staff, support staff, and secretaries. The same district nurse trainee was not only somebody who was trained in these techniques, but also became an active collaborator in this project and created some of her own materials to use the Help Pain program at her school. She created these posters and posted them throughout the various schools within her district. They summarized different skills taught, and they included QR codes so that children could access the self-management videos available on our YouTube channel. Our professional development day was highly successful. All participants felt more comfortable discussing CBT and mindfulness strategies with children who are experiencing pain and found the training to be helpful for education. The majority of providers wanted additional training and support in using these strategies. This is a really effective and successful way of introducing some important aspects of this program to a broader school community. Our district nurse has also shared an individual healthcare plan that she created as an example for others to use when using the Help Pain program at their schools. These are some nursing diagnoses that can be used in the generation of such a plan. Assessment is multifaceted and includes establishing the medical diagnosis, the onset and course of the pain symptoms, assessment of sleep hygiene and sleep habits, evaluation of self-care, getting measures of impairment such as the functional disability inventory, and getting ratings and measures of pain, including an age-appropriate scale like the numeric pain rating scales from 0 to 10 or a FACES scale, evaluating pain intensity, frequency, duration, location, quality, and other symptoms associated with pain. The Functional Disability Inventory, or FDI, is a well-established approach for assessing impairment in day-to-day functioning due to pain or other health symptoms. These are a few examples of the 15 items assessed using this scale, where a child would rate from 0 to 4 how much pain has gotten in the way of engaging in these activities in the last few days. Assessment can be a really important part of managing symptoms because it allows you to see how much symptoms are impacting the child's functioning and how much the child is responding to the intervention. So we really recommend is that the child completes a functional disability inventory or some other rating of how much pain is getting in the way of their functioning. And then a provider such as a nurse or another care provider provides some skills such as mindfulness or other means of supporting the child in the health room. The nurse can then provide education to the family and offer some recommendations to parents regarding management of chronic pain. The nurse can also teach and support self-care through use of our web tools and self-management tools. Here are some examples of what expected outcomes can look like. A student will report an improved score on the functional disability inventory by the end of the school year. The student will demonstrate appropriate self-care by initiating non-pharmacological strategies at the health office visit 50% of the time. The student will demonstrate an improved pain score after an intervention in the health office, or the student will demonstrate improved attendance at school. Here are links to both our Help Pain YouTube channel and our Help Pain Toolkit, which can be used to help support children with chronic painful symptoms. If you have any questions or concerns or want to share any stories about successes in using this program or challenges, please feel free to be in touch. My name is Natasha Cunningham, and I'm a pediatric psychologist and associate professor in the Department of Family Medicine at Michigan State University, and my contact information is included here. Here are some of the references used in this presentation.
Thank you for joining this professional development continuing education activity. Please use the QR code below to scan with your phone or click on the provided link. Your continuing education certificate will be provided electronically to the email used within the post survey following a successful pass of the post test of 80% and submission of the completed survey. Thank you again for joining us for this education.